Welcome to Diabesity Dialogues. I'm Bob Kushner from Northwestern University Feinberg School of Medicine, where I'm a professor of medicine and medical education. And I'm joined by my friend and colleague, Jamie R. Jamie, do you want to go ahead and introduce yourself formally?
Yeah, thanks, Bob. I'm Jamie Ard. I am professor of epidemiology and prevention at Wake Forest School of Medicine. Glad to be here.
Thanks, Jamie. So am I. Glad to be here with you. So, Jamie, let's go ahead and start with a TikTok creator, and I'm going to get your thoughts about this on the other side.
Okay, let's take a look.
Hi, if you're new here, my name is Cecilia, and I've been on a journey to heal my body. Although it seems like it's been recent that I've gotten that diagnosis as type 2 diabetic, it did not come easily. It's taken over a decade of me seeking out help from doctors, constantly being sick, more symptoms being overlooked for over a decade. Some of those things that were overlooked were high glucose levels in my blood work and an A1C test never being ran. Over the last decade, I've gained over 100 pounds and no doctor was concerned about that excessive weight gain. I would drink pitchers and pitchers and pitchers of water while we were dining out for dinner or lunch, and I brought it to my doctor's attention and they just thought, oh, you're just a water drinker. I have been in and out of urgent cares, emergency rooms, doctor's office, even neurological appointments for chronic migraines that were unexplained. With my recent diagnosis and being able to monitor my glucose levels, I now know that my migraines are actually triggered from my glucose levels being either too high or too low. We all know that doctors are practicing medicine, so let's help continue to have this conversation by sharing your stories of signs or symptoms that were overlooked by your doctor that have been reduced or eliminated by using these GLP medications. Share your story over in the comments now.
Jamie, what do you think about Cecilia's post?
Yeah, I think she raises a lot of really interesting points and highlights some of the challenges of clinical care and some of the fragmentation of care often. But let's just start with the basics of, when people are gaining weight over time, I think often clinicians don't pay attention to that and we explain it away. And we don't see that as a symptom of something else going on. You've heard me say this before, Bob. I think that any adult who is gaining weight, if they're not pregnant or they're not a wrestler, that's abnormal weight gain, right? We are rarely in an adult state trying to intentionally gain weight. So just as we would if we had a patient with congestive heart failure, if they came in and they had an increase in weight from the previous visit of 5-10 pounds, even in a few month period of time, we would take that pretty seriously. But we don't think about that as a serious event, health event. And I think she pointed out, she gained 100 pounds over a decade and no one said anything. And it's not until some other complications of that excess weight gain present that then we rally all the troops. And there's a lot to be said for identifying that excessive weight gain early, intervening with that, and then preventing the diagnosis of diabetes that ultimately occurred. So I think that's a really important point in my book.
Yeah, I agree with you. What I heard, and she didn't explicitly say this, but what I'm thinking in the back of my mind is something called weight bias. Now, she didn't say that she felt biased or stigmatized against, but when and you were getting to this, Jamie, a moment ago, when individuals come in with obesity or with overweight, clinicians often attribute all the symptoms to the weight. You're drinking a lot, you're overweight. Now, she didn't say that, but I think we all need to be aware that as one comes in who's overweight and gaining weight, which you're talking about, we think about what else is going on here. It's not just body weight. And the other thing I want to highlight, what you said, is when someone's gaining weight, no one was paying attention. Or we have the luxury of having electronic medical records that will document and be able to visualize trajectories in body weight. And it's so important for our healthcare professionals to be using the EMR and not only looking at trajectories of labs, which we do all the time, but look at the graph tab and look at the trajectory. And if you see that going up, we often say about a 10% weight gain over 1 or 2 years. It could be any weight gain. You really want to pay attention to that. Jamie, let me change gears though. Something we have not talked about in the other episodes so far. We've talked about the benefits of the medication, which is very important for patients and providers to know. But I think equally important are things like safety and side effects.
Yeah, so I have a sort of standard spiel that I use with patients when we're talking about GLP-1 related medications, and usually includes the following. So I say most people will have some type of GI related side effect. Now, the majority of people won't have a side effect that's severe enough or persistent enough to cause them to stop the medication. Um, but you might likely experience something. And that often includes something like nausea, reflux, constipation, or diarrhea. Some people get a little bit of vomiting, but again, 80% of people might experience one or more of those things. And we use a slow titration process. So we gradually increase the dose of the medication, and it allows your body to sort of get accustomed to this new drug being around. And over time, people experience less of these symptoms, fewer of them, and the intensity is lower. I do talk to people about the idea that if you are experiencing side effects, let us know, because there are strategies that you can do, things that you can avoid, ways of eating, ways of consuming your foods, food choices that will make a difference in whether or not you experience more of these side effects or the intensity is higher.
Yeah, I want to emphasize the last thing you talked about mitigating side effects. If you are a primary care provider and you want to reduce the flurry of emails going into your inbox when you start this medication,
Absolutely.
make sure you cover diet changes to reduce those side effects. Otherwise, you're going to be up all night answering those messages. They're going to say, "What did you put me on?" So not all patients, but it really helps. So make sure part of that spiel, as you said, that you tell patients is, here's the dietary changes I want you to try to change to do in order to reduce those side effects.
Yeah.
Jamie, are you ready? We're going to play a game. Are you ready for this?
Well, let's see. What are the stakes?
Just your reputation.
I can go on that all day. I can go on that all day.
I'm going to pivot, and we're going to talk about goal setting, which is very, we talked about, prioritization. What do you want to talk about in the encounter and chief complaint? We're going to also talk about now goal setting, which is more kind of the provider. What are you talking about with your patients? This is going to lightning round kind of a game here. And here's the setup. Do you prioritize or do you not prioritize achieving a target hemoglobin A1C level of less than 7% in your patients with diabetes?
I say I do prioritize that. And I do that mostly because of the data related to lower risk of complications from macrovascular disease when we see A1Cs less than 7. So yes. How about this one for you? Reducing or eliminating the need for medication through lifestyle change.
Absolutely. Didn't even have to think about that one, Jamie. We want to, you and I are strong believers in lifestyle change, right? Healthy diet, adequate physical activity, good night's sleep, deal with stress, avoid alcohol and tobacco and other substances. And the power of lifestyle, of which, by the way, maintaining a healthy body weight is one of the outcomes of living a healthy lifestyle, if possible. You want to try to get people off medication. They love that. Patients really see benefit when they get off of medications. When you can. Absolutely. I mean, if you're on a statin, you're probably on a statin, for example, a long period of time, a blood thinner in someone with coagulopathy. But if you can, you want to get them improvement of lifestyle. All right, my turn to you now, okay? Do you prioritize or do you not prioritize losing a certain amount of body weight?
Ooh, now you're getting tough. So do I prioritize it? No, I don't. My patients often do. I work in a space, as you do, where we see patients who are coming to us for weight management, and they often have a very specific target. I will caveat that with saying that we do know that higher amounts of weight loss may be associated with or are associated with greater reductions in in certain disease states, improvements in disease states, and like you talked about before, increasing the potential for reducing medication needed to control a certain disease. So, to some extent, if we are talking about weight reduction, we're thinking about trying to get to a certain threshold of weight loss that then helps to achieve some of those health goals. So I don't necessarily prioritize it, but when a patient wants to include it as a part of their treatment strategy, then we talk about what would be an appropriate treatment strategy to get to their goal. All right, here's one for you. Which one, health gains or weight loss? And we're going to look at a little bit of a video from a creator here who's contributed that I think will give you a little bit of a context to answer this response here.
Number 2, set expectations from the beginning. If your goal isn't weight loss, tell your doctor that. This is a frank conversation I've had to have with some of my own providers saying, hey, I'm more focused on gaining health rather than the weight loss portion. Can we shift the conversation to that? It is okay to focus on those other wins. Some patient portals may even let you send a message to your doctor prior to the appointment to let them know this information. But if not, show up and put it out there first thing.
I value what she said, and I value her boldness and being prepared to advocate for yourself and come fully prepared when you see your healthcare professional. But my first response is really it's a false dichotomy. I mean, you can gain health and lose weight at the same time. I don't think it's either or. I think the key is what's the message. If you're seeing a healthcare provider and all they're thinking about is you got to lose weight, and that's the driving force, I think the doctor is missing the point. I look at weight as a metric of health. So I'm talking about increasing function, getting off medications, getting your medical problems under better control, feeling better about yourself. Those are all health gains. How's that, Jamie? You buy that?
I'll buy that.
All right. My turn.
All right.
Setting goals without patients' individual circumstances and preferences. What do you think? Is that one of your goals?
No. So that's an easy way to get fired, to not have a patient come back. If you want to get rid of a patient, then do this and just dictate what you want the patient to do without any consideration of their context. And, in all likelihood, if the patient comes back, they're, unlikely to have engaged or implemented any part of that treatment plan. And so I think this one's a pretty simple one. I'll take that softball.
Yeah, I gave that to you. You did a good job with it, but it wasn't easy.
All right, here we go. We'll finish up with this one. How about prioritizing, yes or no, type 2 diabetes remission?
Yeah, that's a good one. That's something that's a word we haven't even used before. It really is brand new. I can't even believe we're talking about type 2 diabetes remission. It is a new concept though, but remission is now talked about in the literature, and it's not impossible or kind of a pipe dream to do so. So I'm going to toss this back to you, James. You do such a better job. What is remission in type 2 diabetes?
Yeah, so remission of type 2 diabetes is really defined as an A1C less than 6.5. So you're below the cut point that we would use to diagnose type 2 diabetes, and on no medications for diabetes for at least 3 months. And, that's now the standard definition that's been adopted by the American Diabetes Association and other groups. And, it's a really important concept because I think of it in the space as disease modifying treatment, right? So we've before really just sort of conceptualized type 2 diabetes as this chronic progressive disease, and people will gradually need more therapy, more intensive treatment, and everyone ultimately, who sees this progression ends up on insulin therapy. And it's just a matter of how much time before you get to that endpoint. That's the way, when I was in medical school, that's the way you sort of thought about diabetes. And now we're saying, given what we talked about in the previous episode, where the relationship between obesity and diabetes is very clear. And we see that diabetes is essentially a longer term complication of that excess weight gain, the changes in insulin sensitivity and all of the, sort of problems that happen as a result of that, that if we address that primary issue of obesity, that we can start to see that the diabetes actually resolves or improves or gets to remission. So let's talk about when we've got a patient and we need to, put together a treatment plan that's going to help us think through this idea of remission or improving control of type 2 diabetes. How do you build a team of collaborators to really help you get to the goal that you and the patient have set? Because, you're a great clinician, Bob. You're a Hall of Famer, right? But you can't do it all yourself. And you need a team to help you. So talk us through, how do you manage that collaboration with other professionals?
Well, first of all, Jamie, thank you for making me a Hall of Famer. That was
Absolutely
very kind of you. I always think of what we do, you and Jamie, you and I and others, as a team sport. If you want to use that kind of sport analogy, we're a quarterback, if you will, because that's kind of the role physicians play. But it is a team sport. We can't do it alone. You're absolutely right. And it is challenging. I want to acknowledge that right off the bat, because we work in an acute care environment. Vast majority of us do, even though this whole Diabesity series is talking about a chronic relapsing disease. So we have to navigate how do we build a team when we're seeing people every 15 to 20 minutes in an acute care setting. But it can be done. You want to identify individuals who are like-minded, have a sense of groupness, so philosophically we're on the same page. And you want to use members that play a key role. If it's access and affordability, you maybe want to think about a social worker, right? How do you get the need for whether it's equipment and other resources in the home? And of course, you have the endocrinologist, and there you're thinking about someone who may have complicated diabetes or ramping up to a continuous glucose monitor, doing things like time in range and so forth, that may need a little bit more guidance with that. So that's what I do, Jamie.
That sounds great. It's nice to have all of that kind of support available. And, the other thing that's really nice these days as we expand more into telehealth is that even if you don't have all of that within your own health system or within your own clinic, you can start to get more of that expertise through telemedicine. And so it's really nice to be able to pull those folks together to work with you.
Yeah. For all of you listening in, teamwork is so darn important, and look around and see who you can add to your team to help patients navigate their disease and have better outcomes. Well, Jamie, it's time to wrap up episode 3. We hope that all of you receive some valuable information about the current goal setting with your patients and working collaboratively to address diabesity. Dr. Ard, see you next episode and talk more about individualizing care for diabetes, utilizing patient-reported outcomes, and shared decision-making. Let's see you soon, and stay tuned.
I'll be there.